Dr. Swati, please unmute and start.
Start? Should I start, ma'am?
Yes.
A very good evening to all the respected seniors and my dear colleagues. A warm welcome to you all on this today's webinar on behalf of Maharashtra AHA and AOP Yavatmal branch on menstrual hygiene, its clinical perspectives and its interrelation with mental health. I am deeply honored to welcome you all. All of us get a patient who is complaining regarding her menses. So today we are going to get practical answers to all our queries. I extend my warm welcome to our Central AHA President, respected Dr. Sushma Desai Madam, our Secretary Dr. Shamik Ghosh sir, and our MAHA AHA team, Chairperson Dr. Chitra Kulkarni Madam, our Chairperson elect Dr. Jayan Pandrikar sir, Dr. Vaishali Shishetty Madam, Secretary, MAHA, and Dr. Ram Bharat Sir, Treasurer, MAHA, our AOP President, so Dr. Sandesh Deshmukh Sir, Secretary, Dr. Vishal Chauhan Sir, and our today's eminent speakers, Dr. Sneha Buyar Madam, gynecologist from Yavatmal, and Dr. Sanjay Ratna Parkhi Sir, very well known to all of us.
स्वाति आप म्यूटेड है.
Yeah. Now audible?
Yes. Yeah.
Yes.
Yeah.
So now I request Dr. Chitra Kulkarni Madam to have opening remarks and do the honors of introducing our chief guest.
Thank you very much, Dr. Swati. And I am really humbled to see so many Central AHA and our IAP President also for this webinar. Thank you very much for being here with us with a unique subject of getting the adolescents and their issues in mainstream. May I welcome our chief guest, Dr. Neha, please, can you share the CV? Dr. Geeta Patil ma'am is our chief guest today, and we are really very happy to have such a senior person as our chief guest in our Maharashtra webinar. Dr. Geeta Patil madam is from Bangalore, and she is the backbone of present 360-degree pediatrics, which is appreciated by all of us. She is chief editor of IAP-AHA textbook of adolescent medicine and the recently concluded MAHA-AHA Con 2026 scientific program was based on this textbook. I'm really thankful to ma'am for this, and she's a national scientific coordinator for IAP Ki Baat community ke saath from 24-25. She's a coordinator for AHEAD module, which is very popular among pediatricians and being conducted in various parts of India. She's a course convener and my teacher of mental health IAP ICP, which was second batch was concluded and everybody appreciated it. The academic and executive editor of 360-degree pediatrics, and over 50 people are going to get that textbook. A very good news for all of us. She's having special interest in adolescent medicine, infectious diseases, nutritional problems, and she is always a faculty at national conferences. Welcome, ma'am.
Yes, thank you, Dr. Chitra.
Yeah.
Thank you for
Please give your blessings.
So, thank you for your kind words. Let me at the outset thank Maharashtra Adolescent Health Academy and AOP Yavatmal for giving me opportunity for this unique session. I think recently Maha AHCon was concluded, and with a great appreciation and hard work done by Dr. Chitra Kulkarni was talked everywhere, and it was very precise scientifics where in spite of so many challenges what we face always have been, all of them were there. And I'm very thankful to Dr. Sushma Desai, Piali Madam, Himabindu, Dr. Himabindu, Shami Ghosh, and Deepak Gautam. Dr. Chitra Kulkarni's hard work we have seen, and her interest in academics. I think recently we have met few days back in Mumbai, and that time she was continuously under stress, I could see, because she was having this responsibility of conducting Maharashtra Adolescent Health Academy conference, and was ably assisted by Dr. Jayant Pandrikar sir, Dr. Shailaja Mane, and I think secretaries Vaishali Shirshetty and Ram Bharat. Ram Bharat also was one of our student in the mental health, and I'm very happy that today's topic is, and Sir Sanjeev Joshi sir is there. That shows that unless we are in IAP, the things cannot go forward. Neelam Mohan madam has, that is the reason it is started with 360-degree IAP practice guidelines. And thank you very much, sir. You could spare some time. Vaishali Shirshetty is there now, I could see. I think very happy, Vaishali. I think she's my alumni, so I'm more proud of her. I think
Yeah, thank you, madam. Thank
we
you.
belong to the same place.
Yes.
So, and this is a really unique topic because menstrual problems we are definitely discussing, and many times uh, we have discussed the points which are required, but mental health and menstrual health, that is the one which is being combined to give a holistic menstrual health guidelines to the adults. I think this is a great thing that we all have never discussed. This may be the first time this may be discussed on the any platform, IAP or adolescent platform. What I feel when Chitra told me that menstrual health and mental health, now time has come for us to divide even physical problem according to the stage of the adolescent. Because when I thought early, mid, late adolescent has got a peculiar issues of the menstrual health as well as mental health. So now I think we are going to be enlightened, and wish you all the best. Happy learning. Thank you, Dr. Swati, for coordinating. And I think I can see Dr. Sandesh Deshmukh. He is a president of AOP Yavatmal. And I think I know the speaker of today. Ratnaparki sir, I think I have done some programs with him. I know his passion, Sanjay Ratnaparki sir's passion, I know very well. And I think we have got a very eminent gynecologist. Rightly, you are involved, a gynecologist. We need sometimes support. The moment we go to the late adolescent, maybe early and mid we can tackle, but late adolescent, definitely we need to partner. So this is a great initiative, and wish you all the best. And Dr. Subodh Gupta's, like academicians are there. It shows the interest in the topic, and I am very sure the speakers are going to do justice to this topic. And thank you very much, Dr. Chitra, for inviting me as a chief guest. I am greatly honored and overwhelmed also by this, by getting invitation as a chief guest. Thank you very much. Blessing and wish you all the best for this program. Thank you again.
Thank you so much, ma'am. Thank you so much.
Thank you. Thank you.
Thank you so much, ma'am, for your kind words. Now I will request our MAHA HS Secretary, Dr. Vaishali Shetty Madam, to introduce our today's guest of honor, Dr. Sanjeev Joshi sir. Over to you, Vaishali ma'am.
Yes. Very good evening to all of you. Can I get the slide, please? Yeah. So, as you all know, Dr. Sanjeev Joshi is MAHA IAP president now. He is a director of Chirayu Criticare and Joshi Clinic Hospital, Yavatmal. He is a Maharashtra IAP president 2026 and executive board member of 24-26-25. He is a national chairperson 2024 AOP Neurology, ex-national secretary AOP Neurology, and ex-president Vidarbha Pediatrics. Chief organizing secretary for this and chairperson of Pedicor 2023. He is a visiting fellow to Australia and UK national faculty to pedicon as well as neocon, neopedicon also, and NCPID. He has contributed to many books and many CIP modules. So welcome you, sir, and thank you very much for joining our webinar. We are overwhelmed because of your presence, sir. Thank you so much. Over to you, sir.
Namaskar. Very good evening. And it's a good day for Maharashtra because we are experiencing the first rain of this monsoon. So it's a great privilege and honor to share the screen with the dignitaries and luminaries of the Central HA, Dr. Ghosh, Dr. Desai, ma'am, and of course our mentors in AHA and also in IAP, none other than Dr. Geeta Patil. Uh, मला थोडंसं एक फिक्स मध्ये I am today I don't think that I am a guest at all because when Yavatmal is hosting this important academic activity and Yavatmal is a place from where my academic journey has started and my roots are still with you. So consider me as the host, Geeta Madam and Chitra. And difficult to narrate the diligent and proficient work done by the state AHA team under the dynamic leadership of Dr. Chitra, the upcoming leadership of my dear friend Dr. Jayant and Dr. Shailaja, Dr. Ram, Dr. Vaishali. You are doing a fantastic work in the field of adolescent care.
Sir,
I
also
don't
Dr.
consider,
Neha Singh. Also Dr.
and
Neha
Neha,
Singh.
Neha, of
Yeah.
course, Neha
I
also,
think
of
Dr.
course,
Neha Chitra, I
Neha,
forgot. Neha is
Neha,
always there. She's
Neha.
in
Yes,
academic.
yes, yes.
Sorry.
And of course, I must congratulate my home team of Yavatmal, Sandesh, Dr. Swati for hosting such an important activity. So I don't consider that this AHA activities are just a series of lectures. You are providing a toolkit to the adolescent uh, healthcare in a way that they should be the practicing pediatrician and the parent should empower with the changes and challenges in the field of adolescent care. As you know, adolescent is a very hyper dynamic stage of the kids. It is just not a stage of transformation; it is a stage of revolution also. And today's topic, the importance has already been mentioned by Geeta Madam, so I will not go into it. But I must grab this opportunity to welcome our own speakers from Yavatmal, Dr. Sanjay Ratnaparki, a champion of mental health himself. Even I have studied few lessons under him. Getting up early in the morning at 4 a.m. was one of the important lesson of mental health. So I welcome you, sir, on behalf of Maharashtra IP. And the other speaker, Dr. Sneha Bhuya, she is a well-known figure in OBGY at the national level, an astute clinician and an academician. So I welcome Dr. Sneha, madam. And of course, our today's host team of Yavatmal, Sandesh, Swati, and Dr. Vishal. Thank you for having me here. Uh, so let us not interfere between the knowledge. So I'm just signing off with and just requesting all the attendees, those who are here, take these messages of this lecture and percolate them through their uh, uh, percolate them to the parents and the adolescent. Thank you all. Wish you a very happy learning.
Sir, Sanjay Joshi, sir, let me thank. Your background is IIP के बाद community के साथ. So I'm very
Thank you.
happy. 1.0. That was the first in 24.
Yes,
Same
yes.
it is there. I've seen
Sir,
after a long time, sir.
yeah, Madam, our Maharashtra IP is doing a mammoth work in the field of community work by our anemia activity. We have screened almost 70,000 kids across the state. So I must congratulate all the district office bearer for this.
Thank you, sir.
Thank you, madam.
Thank you so much, sir, for your kind words and all the inspiration. Now, I will request our today's chairperson, Dr. Sandesh Deshmukh, sir, President of AOP Yavatmal branch, to introduce our today's eminent speakers. Dr.
Hello, Swati.
Hi, yes, sir. Over to you.
Okay,
Dr.
welcome.
Swati,
Namaskar.
Dr.
Namaskar
Swati,
to
we have
all dear colleagues, my friends, respected teachers, and IIP office bearers. It's my honor and privilege to be chairperson and to introduce today's speakers, both the speakers. Uh, I firstly thanks IIP Adolescent Branch to consider uh, for this webinar and given chance to AOP Yotman. As the president of AOP Yotman, I thanks them a lot. I firstly introduce Dr. Sneha Buhar Madam, who is going to talk on menstrual health. She is very known in Yotmal also and in Maharashtra and through his academic and research work in India also. She has done his MBBS MD from BJ Medical College, Pune. She is managing director of Sukrata Surgical Maternity Hospital and Laparoscopy and Infertility Center. She's been practicing for 34 years and has teaching experience of 5 years in Government Medical College. She has been awarded various awards, like national awards for national individual awards of Foxy for outstanding work in rural obstetrics, and also Shah Community Service Awards in 2022. She also received Anandabai Joshi Award by Government of Maharashtra in 2005. She has got also appreciation award for public awareness and appreciation award for exemplary work in cancer. She is also national expert in UNICEF and also got Lokmat Healthcare Award, Excellence Awards in 2020. She has also held official post in various organizations. She is presently state coordinator of AMOX. She is also national chairperson of ISOPAR's quiz committee, chairperson of Breast Community Foxy in 2019 and 21. She is also chairperson of Mental Disorder Committee of AMOX in 22-24. She was also president of YOGS 2000 in 2007
Thank
and
you.
founder
Thank you,
clinical
Dr.
secretary of YOGS
That should suffice.
and executive committee member of AMOX. She has also more than 300 talks at state, national, and international conferences. Also published 25 articles in national publications. And she is also organization chairperson for Criticare and Zonal Amox and Lactocon and Restcon. She has a special interest in cancer research. She was a primary investigator in fighting against cervical cancer in 2020, coordinator of Ankur project and research in menopause and cervical cancer. Our second speaker is Dr. Sanjay Ratnabarki. He is a senior pediatrician from Yotmal. He is working with Chiranjeevi Hospital, RD Road, Yotmal, and also has Health Guidance and Relaxation Institute. He has also apart from pediatric degree, he is also educated in a postgraduate diploma in adolescent pediatrics, geriatric medicine, postgraduate diploma in clinical hypnosis, and a somatic experience practitioner and internal somatic psychologist. He has achievement of Organizational Excellence Award of Maharashtra. He also was president of IMA Yotmal and IIP Yotmal and president of Adolescent Health and Academic Yotmal. His special area of interest was healing patient in scientific and holistic ways. Today he is going to talk about menstrual health and its mental hygiene. Thank you, sir.
Dr. Swati, may I request, we are having Central AHA chairperson with us and secretary also, Shamik sir. We request them to give their blessings.
Yeah. Yes, ma'am. I will I will request our Central AHA President, Dr. Sushma Desai Madam, to have words of wisdom for us.
Sujata Paje, SM Vision Cook.
Ma'am is there or not? Yeah. Okay, Shamik Ghosh sir. Has sir joined?
He has messaged me, ma'am.
Okay, I could
He
see
couldn't
Dr.
join.
Jayant Pandrikar. We will request him to give his blessings. Dr. Pandrikar, please. I think we should go ahead.
Yes, yes, ma'am. So now we will start with our first lecture. Uh, but before that, I would like to say one line towards to show the commitment and dedication Dr. Sneha Buyar Madam is having towards her work. She got her daughter married on 21st of June, and
Yes.
in spite of that she said yes for this today's lecture on my one call only. So thank you so much for that, ma'am. And now you are such an inspiration for all of us, and now we are very eager to hear you. So please start with the lecture, ma'am. Over to you, Dr. Sneha Buyar Madam.
Thank you. Thank you so much. Very good evening to one and all. Let me first thank the Central AHA President and his own team, and congratulate and thank the Maharashtra AHA team. Special mention of Dr. Chitra Kulkarni Madam, the President, the Chairperson of MAHA AHA, and her team. Let me congratulate the Maharashtra AP as well, and the AOP Yavatmal team, Dr. Sandesh Deshmukh, and special mention of Dr. Swati. So with this, without much ado, let us start with our presentation for today. I hope you can see my presentation.
Yes, ma'am. We are able to see.
Yeah, so I hope it is full screen. So it is indeed my pleasure to be here, and my special congratulations to the team for taking up this initiative, because what we are going to discuss, it is the need of the hour. As the age of menarche is getting reduced day by day, it's time that pediatricians, start counseling and start managing the initial problems. That's what we're going to discuss towards the end of the topic. So, what is menstruation? Rather than menstrual health, we'll start with briefly what is menstruation. It's a natural monthly process of shedding the endometrium and the debris that indicates the activation of the reproductive system. Age of menarche may vary. Over the time, it's getting reduced from 16 years to 13 years, and now almost 10 and 11 years, So the menstruation is normal. It's not dirty or shameful. That is what the message we have to pass on. Open conversation with the mother is the best thing that can help the child. Mother-daughter conversation about menstrual health is very, very important. And then, of course, the peer groups, especially the healthcare worker, educating the young girl about the menstrual hygiene. This is very, very important. Um, all of you are pediatrician, I understand, but yes, little in short, I have to say this, that female sexual cycle, the female cycle is having two cycles in it. The ovarian cycle, which consists of the follicular phase, the first 14 days, ovulation on 14 days approximately, and the luteal phase where the corpus luteum is formed. Endometrial cycles, the first 14 days of proliferation, where estrogen is the predominant hormone, and after ovulation, the secretory phase, where the progesterone is the hormone. So, this is what is the entire cycle. We need to just understand to explain in a simple language to the public, of course, the child and her parents. So, HPO axis has got the key role. The hypothalamus secretes gonadotropin releasing hormone, which acts on pituitary, from where the gonadotropin, FSH, and LH are released. They act on the ovaries. The FSH act on the granulosa cells to secrete estrogen, and the LH acts on the theca cells to produce progesterone. So these are the ovarian hormones. HPO axis is actually the central regulatory system controlling the menstrual cycle through a complex feedback loop of hormones. So we have already discussed about the control. It is the main control. But yes, estrogen and progesterone have got different effect on the various neurotransmitters. So estrogen influences serotonin. It acts on the serotonin synthesis as well as improves the receptor sensitivity, and it has got a dopaminergic activity as well. So it helps in calming down and having the pleasant status of the girl or the child. The clinical significance of this is that the HPO axis demonstrates the direct connection between the reproductive hormone and the brain function. And this explains why menstrual disorders are often present with psychological symptoms and why mental health complaints may have hormonal influences as well. So as the girl gets her first initial menses, she may have certain physical symptoms like cramps, which is the lower abdominal cramps, may be starting from the sacrum. So lower backache and the abdominal cramps, breast tenderness and fatigue. And then of course, she may have mood swings, irritability, anxiety and sadness. But we have to accept and explain them that these symptoms are normal. Almost 90% of the women, the girls, at some point of time in their reproductive years, they have these symptoms. The severity may vary, but they do have these symptoms and they are normal. But when to seek help when these symptoms become severe, to disturb their routine life, to disturb their studies, their work. So for that, we have to know what is normal. So the cycle length, as usually we say in the pictorial manner, 28 days, but yes, or at least 4 days or 5 days on either side. The normal range is 24 to 38 days. The duration of flow should be between 4 to 8 days. More than this is abnormal. And the blood loss is up to 80 ml. Variations outside this range definitely warrant medical evaluation. Once the girl starts the menstruation, she has to be informed about the sanitary products available and how to use them and what are the advantages. So definitely sanitary napkins, tampons, menstrual cups and period panties. We have to explain that these are the resources available and you have to choose the right one as per the requirement. Menstrual hygiene definitely has a role in menstrual health. So she has to use her pads, change every 4 to 6 early, tampons, very, very important because forgotten tampon is the most, dangerous thing to happen. Girls have landed up into sepsis, septicemia, toxic shock syndrome. So we need to train them, teach them about the change of tampons in timely manner. Menstrual cup, yes, 8 to 10, 12 hours, depending on the capacity and the flow. Every time before using or changing the sanitary napkins, make sure that she washes her hands with soap and clean water. Keeps the genital area clean and dry, and of course, wear breathable cotton underwear. Changing the sanitary products before they become saturated, always wiping from front to back, avoid scented intimates or use cleaning the genital area and dispose of the used products hygienically. We have to train them. we have to guide them about the foods to eat during these periods. I would say the healthy food they can have every time, rather every day. Iron-rich foods, especially green leafy vegetables, jaggery, dates, beans, and the protein-rich foods like eggs, milk, pulses, fruits, and hydration. Adequate water is the key of good health. Eat small and frequent meals, especially not to have spicy food. Omega-3 rich food to reduce inflammation. Magnesium rich foods to, that helps in management of cramps. Warm herbal teas can provide comfort and hydration as well. Foods to limit excess junk food, excess sugary drinks, too much of caffeine, and excess of salt. I would say not only during this period, but every time. Why? Because these are the foods which can worsen their bloating, water retention, cramping, mood swings, discomfort, and even the cyclical mastalgia. So, fresh vegetables, fresh salads, fresh fruits, and active physical exercise and yoga. So, you must have heard about the taboos that you should restrict your activities, do not do any exercises, but walking, yoga, stretching exercises, and light exercises are definitely recommended. They, in fact, help to reduce the cramps, improve the mood, and better sleep for the girl. These are just the various positions for yoga. So, menstrual health is not only about bleeding, it's about the physical well being, the emotional well being, the social well being as well, which actually leads to active participation in the social events, dignity, freedom from the stigma, and of course, access to healthcare. Menstrual health is actually a window for the women's health. So all of us have to take care of menstrual health. According to WHO, it is actually the complete, it is a holistic health, physical, mental, social well-being related to menstrual cycle. It's not merely the absence of the disease, but it's a fundamental right of a woman and girl. Now we are talking about estrogen and progesterone. So how does estrogen helps? Why first half of the cycle the girl has very good mood and suddenly during the second cycle or closer to menstruation, why the mood becomes, there are fluctuations, there's anxiety, because estrogen is the one which it boosts the activity of the serotonin, it calms down the mood, motivation and focus is improved, it modulates the gamma aminobutyric acid receptors as well. So stress resilience is good, stabilizes glutamate, and there is emotional balance as well. So menstruation, it affects almost 1.9 billion women globally. So we have to look for the impact, what all fields they have their impact. Education, definitely, because of all these issues, the school absenteeism, limited participation, of course, it impacts on the performance as well. Productivity at workplace, similarly, absenteeism or reduced output. Mental health problems like depression, anxiety, stigma, fertility, definitely on either side, reproductive health indications as well as family planning. Quality of life is definitely hampered if the menstrual health is not maintained. So, according to American College of Obstetrician Gynecologists, in addition to temperature, respiration, pulse, and blood pressure, in fact, menstrual cycle should be considered as a fifth vital sign. That is what is recommended. And here we have to keep tracking all the parameters, as we have already said, the cycle length, duration, flow, the associated pain, and any other symptoms. So regular tracking of these parameters helps identify the abnormalities early. Changes in the menstrual cycle can be the first indicator of underlying other disorders like thyroid disorders, PCOS, which is now called as PMOS, polyendocrine metabolic syndrome, and the nutritional deficiencies as well. Menstrual health in adolescents, reproductive age group, and of course the perimenopausal women. All these women, they actually have to be supported and guided. So you need to help the women at all age group. So this is about the normal menstrual health, normal menstruation, I would say. Now, what are the disorders associated? excessive bleeding, that is heavy menstrual bleeding or abnormal uterine bleeding as we call it as. FIGO has given this Spam-Cohen classification. On left-hand side, you have the anatomical causes, polyp, adenomyosis, leiomyoma, malignancy, and on right side, you have the functional causes, coagulopathy, ovulatory dysfunction, endometrial causes, iatrogenic, and not yet classified causes. Now, what are the impact of this heavy menstrual bleeding? Heavy menstrual bleeding, the impact is so much on overall health that it can actually worsen her physical as well as psychological health. So iron deficiency, anemia, fatigue, easy fatigability, reduced productivity, lack of concentration because of this. So we have to assess her menstrual history and the PBAC score, the complete blood count, ferritin levels, and of course pelvic ultrasound if it is a persistent symptom. Management will definitely, of course, for you, you have to refer to gynecologist, but yes, for initial primary management, you may prescribe tranexamic acid and just to stop or control the bleeding. But then, of course, surgical intervention and lifestyle modification should follow. The next symptom is dysmenorrhea, which is quite worrisome. But depending upon the onset, we classify it as primary, where the girl has pain during menstruation right from the beginning. And this is not associated with any underlying medical condition. In fact, it is very severe within the first 72 hours of menstruation, but it decreases over the time. And that's the reason I'm sure you must have heard the mother tells the daughter that it will disappear or it will reduce when you grow up. Secondary dysmenorrhea is caused by the underlying reproductive system disorders, and they are longer lasting and more persistent. In fact, they worsen with time because of these diseases like endometriosis, adenomyosis. I will not go into the details. I keep it in mind that you all are pediatricians, so I don't force you to go through all this. But yes, PCOS or PMOS, which is now called as, this is definitely has impact on the girl's future. So catch them young. That is a message from our side. Catch them young. The very fact that initial years of menstruation, you find irregular cycles, growing obesity or increasing weight, and maybe excessive hairiness or excessive acne, that is a time, though PCOS has got an effect on the entire body, all the organs, these are the early signs where you can catch and refer her to gynecologist and maybe endocrinologist for better management. Now coming to the um, effect of this on the mental health, menstruation and mental health, right from all puberty, you have effect on the various age group. But why women have got, why do we think about menstrual health? Because women have a higher prevalence of having the mental health issues, because it is all, if you compare with men, it's almost double. So common conditions like, they have eating disorders, perinatal mood swings or mood disorders, and even they can have, even when you have change in the lifestyle, even shifting to other places, maybe some other stress, they can, either trigger her mental health or worsen the pre-existing one. So during puberty, because of all these problems, she can land up into anxiety, depression, body image concerns. During pregnancy, she can have mood swings and she may have depression, anxiety, lack of sleep as well. Postpartum period is the most vulnerable period for mental health issues because of the rapid decline in the hormonal levels, estrogen especially, the postpartum depression, postpartum blues, and even sleep deprivation or failure to adjust with the motherhood. All these problems can arise. Menopausal period is a gray zone, definitely, she is facing so many problems. So along with the vasomotor symptoms, the dryness and all these things, sleep issues also worsen her problems. So understanding women's mental health is crucial. Understanding the hormone mood connection can unlock better mental illness or mental wellness, I would say. adolescent is the most vulnerable age group because they may have fear of, once they start with menstruation, somebody needs to help them. So fear of leakage, soaking or staining of the clothes, discomfort in public, maybe fear of being judged or teased by others, and shame. Menstruation, it's a stigma. You are not supposed to talk openly about it, you're supposed to hide. Lack of education definitely has a problem. The limited access or no accurate information about periods, hygiene, and body changes lead to confusion. The moment you find the girl has already landed up into menarche, the mother, family, or even the close peer group should support her, inform her about the necessary products. We have talked about it, but lack of the menstrual products, that is called as menstrual poverty, lack of pads, toilets, education, result in anxiety, embarrassment, and school absenteeism. So there are almost 500 million women, they lack access to menstrual products. And 1 in 5 girls in India leave school after menarche for various reasons, of course. Period poverty affects mental health and dignity as well. Menstrual health definitely affects the academic performance, as we have been talking about. Excessive blood loss leading to anemia, the fear and constant discouragement, isolation, reduced concentration, missed classes, lower performance. Now, we have talked about the effect on the mental health, but when should a gynecologist suspect mental illness? I would say when should a doctor who is attending her should suspect? Persistent sadness. If a girl, you find that she's always sad, the ongoing feeling of sadness, that is a time you have to recognize her. Severe anxiety, every time she becomes stressful, she becomes panic. Self-harm thoughts, maybe sometimes, she feels I'm not happy, I'm not getting my work done, maybe, I hate myself. So the self-harm thoughts and functional impairment. This is a time, as we have all, these are the red flags, and this is a time where you have to start routine screening. We have to incorporate the routine screening. We have to take the mental health history. I'm sure Dr. Sanjay Ratnaparkhi will be covering this, so I will skip this part. Referral pathways and collaborative care. Definitely, we were talking about the hormonal effects. So estrogen leads to better mood because of the various reasons we have talked about, the serotonin boosting and other neurotransmitters as well, increase energy and improve cognition, enhance sociability as well. But on the other hand, during luteal phase, dominant progesterone, emotional vulnerability, anxiety. Am I audible? Hello?
Yes, ma'am, you are audible.
Okay. You can tell me about the timing if at all I'm overshooting. Please let me know. Okay.
Very continuous. The minute.
Hello. So emotional vulnerability, anxiety, irritability, and low motivation. So hormonal fluctuations across menstrual cycle directly impact neurotransmitter systems.
So put her in the half volley bracket, but the way she hits it through point that line.
Dr. Vaijayanti, please mute yourself.
So progesterone metabolite allopregnanolone, which is present in the second half of the cycle, that acts on the GABA receptors. Usually it leads to calmness, relaxation, sedation, but the imbalance may trigger anxiety and depression. Now, the menstrual symptoms which actually can affect the mental health is dysmenorrhea, menorrhagia, irregular cycles, fatigue, and sleep disturbances. we have to recognize these symptoms and seek support. They can improve their mental health as well. So we have to seek the support as early as possible. Otherwise, it can result in stress, poor concentration, reduced productivity. PMS, premenstrual syndrome, which is a very common disorder. I'm sure all of you have heard about it. Almost, it occurs 5 to 10 days prior to the menses. As the menses come closer, the girl is already depressed. She's irritable. She's anxious. She may have, crying spells and may feel fatigue, not feeling like doing anything. So we have to just make sure that these symptoms are only cyclical. They recur every monthly and they resolve after menstruation. So there's no need to worry. This is just PMS. But definitely, yes, you can support them by counseling, maybe with constellation, physical, psychological, and behavior, improvement. You can guide them. Physically, during this period, they feel bloated, they have breast tenderness, headache, fatigue, and behavioral problems. Some people have food cravings, some people have sleep changes. So we have to make sure that these are only PMS and these are not very severe, though it affects 20 to 40% of the women. So we have to be sure and we have to help them, support them, and guide them how to how to get over or overcome these symptoms. Severe form of PMS affects almost 3 to 8% of women. Um, we have to just differentiate them from major depressive disorder or anxiety disorder, sometimes even hyperthyroidism and other problems. PMS and PMDD, these premenstrual dysphoric disorders. I will just run fast over this.
Sorry to interrupt you, ma'am.
Uh-huh.
We have 2 or 3 minutes left.
Okay, I should skip these slides as it is. They are about mental health, but yes, definitely evidence support that we are talking about the nutritional supplements and nutrition and exercise, how to improve their mood and how to give them supplementation of calcium, magnesium, vitamin B6, and omega-3 fatty acids. Supportive families definitely can reduce the anxiety as well as stigma and the emotional burden. We have to go for menstrual literacy, school programs, and workplace policies as well. Every menstrual complaint has a psychological dimension, but every mental health may have hormonal influences. So we need to screen them routinely. Menstrual health and mental health, they are inseparable. So we have to tackle them together. We cannot separate them. The future directions are, of course, running the menstrual mental health clinics, digital symptom tracking, and greater interdisciplinary collaboration. I would just fast move for few more slides. Just give me 2 minutes. So, what is the pediatrician's role in this? So, we have to educate the girls and their parents on the menstrual health. So right from puberty, menstrual cycles, and how to take care of these girls, how to help them using the menstrual product and all these things, which we have covered in earlier in the talk. So promote menstrual hygiene, screening for menstrual disorders. We have covered all these disorders. Early detection of underlying conditions like PCOS, thyroid disorders, bleeding disorders, and other endocrine abnormalities. Even congenital reproductive tract abnormalities, as we talked about the primary amenorrhea, etc. Prevention and management of anemia, so nutritional supplementation as well as medication, addressing mental health issues, nutritional balance, and then of course vaccination and the preventive care. We have to counsel them regarding HPV vaccination, adolescent health checkups, and reproductive health counseling as per their age. Safeguard the education and participation, reduce school absenteeism due to menstruation, encourage participation in sports and extracurricular activities, promote menstrual-friendly school environments, of course. Their pediatricians should work with their parents, talk to the parents, discuss with teachers, as we all most of the times go to the schools and discuss with teachers as well as parents, school health programs, gynecologists, of course, they do their job, but yes, they have to widen their horizon as well. So thank you so much, the team, once again, for having me here. And I hope I've done justice to the topic, tried to curtail the mental health issues as Dr. Ratnapark is going to cover. Thank you so much.
Thank you so much, ma'am, for such a informative lecture. Many of our day-to-day practice doubts has been cleared in this lecture. I think we could hear you more, ma'am, but because of time constraints, so now I will invite Dr. Sanjay Ratna Parkhi sir to start with his talk on menstrual health and mental health interrelation, how both are interrelated. Over to you, sir. Please
Thank you.
start.
Thank you. Am I audible?
Yes, sir, you are audible. You can
Okay.
start.
Thank you. Thank you, everyone. Dr. Chitra Madam, Dr. Swati, Geeta Patel Madam, and all who are here. That passion which is being seen in everybody to stay with eyes open, ears open, and passion on. Very, very interesting to observe this. And let us go with this widened passion into this field of mental health. I'll be sharing you screen, but more important is the message which we are going to share. So, all my colleagues and friends, the first thing what we are going to understand is the menstruation is the jewel of the woman. It is the dignity of the woman. It's the power of woman. It's the identification of woman. If you remember, who is the most beautiful woman in the world who was recognized? Can you tell me the answer? Which is accepted here? Anyone?
Mona Lisa?
Mona Lisa.
Mona Lisa is a picturized woman. It is a picture, basically. The most beautiful woman which is accepted for the world is Princess Diana, the Charles' wife. And in her autobiography, she says, when I entered, I was born in a family. She was born in a teacher's family. I was unwanted. When I entered in Charles' life, Princess Charles' life, I was unwanted. When I entered in royal family, I was unwanted. See, these are the words of beautiful lady. I was unwanted. And she criticized, I want to be wanted. Can you understand? This is the basic. And therefore, you to understand menstruation, not a very simple hormonal event. As sleep and awakefulness is related to your earth cycle. So similarly, menstruation is related to the moon cycle. She is a feminine energy, full of feminine energy, love, affection, and authenticity, which is totally different from male. Male is a person who is rich in testosterone, monotracking brain, and very constant hormonally. But girl is not. A woman is not. Woman is daily changing internally, hormonally, day by day, and we don't understand this. All men are perturbed. And they say women are really complicated. This sentence being done right from ancient world today also. No man cannot and understand woman because she is hormonally different and she really different. The greatest problem which we have, woman doesn't understand herself also. That is the problem. And therefore, she feels she's neglected from the community internally. She neglects herself. And that is the reason why Princess Diana is saying this. So, women are. Now, let us understand is it that estrogen progesterone making the effect? It's not. It is the peripheral impulses which are reaching to the hypothalamus. That sandesh, that sensation which goes to hypothalamus is creating sense of well-being. And if you are having a sense of well-being, sense of coherence, your internal biology will remain static and nice. But if you're chronically dysregulated, if you're chronically unsatisfied, if you're chronically feeling low, if you're chronically anxious, what is happening? Your hypothalamus is getting sense of constant dysregulation. Okay, constant. I am not. See, look at any adolescent. Everybody is running. I am not. I have to perform. I have to do this. I have to. So internally, what hypothalamus sensing? That this particular child is dysregulated, is chronically activated, what we call as a hyper aroused state. And a person is in hyper aroused state, anyone, naturally, hypothalamus is going to secrete lot many hormones. Lot of steroids are being secreted. Lot of estrogen is being secreted. Lot of progesterone is being secreted. And imagine now adolescents who are exposed to lot of explicit material constantly. What would happen internally? Okay, there is a lot of material which is coming through mobiles, and internally this is bad. Now, can you see that severe type of war which is going inside? We all pediatricians see this war, but we just label it as hormonal imbalance. And here mental health problem comes. And therefore, this is a new understanding of menstrual cycle. I am woman, so menstrual cycle is my right. I should accept it as a very and many of the communities accept menstruation as a problem. मला problem आला नाही, माझा हा problem आहे. अरे, is it a problem? Can't we look it in different perspective to a very simple natural process, and any process which you consider unnatural, we always give trouble. Say passing stool become a natural process. But if you are making it product, constipation, loose motion, you are dimensionally trapped into a domain of problems, and therefore we are facing problems. So what is the secret? Is now let us understand there are two important states what this Bhuyar madam told. One is the pre-ovulation phase and one is the post-ovulation phase. Pre-ovulation phase is the estrogenic phase. What happens in the estrogenic phase? Where she is woman, she is a creative woman. She want to do something. She want to express herself with her all modalities. She want to be good. She want to be accepted. And once she feel that accepted, once she is having a lot of wings to fly in the sky, then her estrogen level will be normal. But if it will not, then it will be suppressed inside. And huge suppression of estrogen in the body is going to produce ovarian disorders. This is a new view. Unfortunately, we are always trapped in that hormonal imbalance. But there is the why. Ask the question, why there is so many post-PCODs are there? Why so many menstrual disorders? Ask these genuine questions to yourself. You will find the answer. The next phase is progesteronic phase. What happens in progesteronic phase? Here, woman needs love, affection, race, caring, because her body is meant for pregnancy. Her body is meant for child care. Her body is meant for relationship. Her body is meant for expression. And if it's not allowed to express, all expressions suppress. Let me tell you a very interesting, simple joke. A beautiful garden, a beautiful bench, and two ladies were there. They were sitting idle for half an hour. Have you understood the joke? Two ladies were sitting idle without speaking a word for half an hour. Not possible at all, because they feel good when they express themselves. They feel nice when they talk to somebody. That is reason. Inability to express their emotions are trapped inside. Inability to feel that creative dimension, they are trapped inside. And all my dear friend, this is the reason for disorders we express. This is the reason. So if you understand this woman world is totally different, and therefore deep inner work is essential. Everybody need a deeper and deeper inner work. What is happening within me? I sincerely ask you this question to everybody. And we'll take a very short practical today, but do inner work. If you are feeling good, see how you are feeling good. If you are not feeling good, see how you are not feeling good experientially. And therefore, the secret of mental health is bringing dysregulation to regulation. And that required a small rest. And that is where the work. Do you know that so many people, they are going for meditation, but they're actually disturbed by meditation? This is a secret, because whenever you do meditation, the suppressed inner conflicts, they will always surface and you try to compress, and this is constantly causing dysregulation. And therefore, you're always trapped into the defensive states. And what? Anxiety is not disease. Depression not, it is a defensive state you are trapped in for years together. And therefore, you have to restore this balance through mind, body, and internal work. So, I sincerely request everyone, when we'll do a small practical, just go within you. How do you feel internally? Anytime you feel disturbed, see how I feel disturbed and where I feel disturbed. And this is how now psychology is moving towards what we like embodied psychology. Okay, there has to be reason. Disorders cannot be idiopathic. There has to be reason. So you have to look from different angle. And therefore, to restore, you have to become wise. Okay, to create a wisdom. And if you are able to create a wisdom, these are three tools. Analyze. Simply ask question. If you are having acidity, see why I am eating acidity. If you are having menstrual disorder, what is happening within me that is causing disorder? This knowledge can be done by brain-wise understanding of it. There are two important states. One is neocortical state, which is called an education state. Okay, but same knowledge is given to every student, but internal disturbed students cannot make because they are disturbed inside. So this internal dysregulation is brought to regulation by proper activities, by this analysis, awareness, and transformation. And if you understand this, then if you change your hypothalamic attitude towards the stress, then stress is there in everybody's life. No person can live without stress. But changing view towards the stress and acknowledging what is happening inside is real solution. So are you ready to accept this change? एक 5 मिनट का प्रैक्टिकल करने के लिए तैयार हो आप? Yes. Then I will demonstrate what will be happening here. Are you ready? Yes or no? बोलो.
Yes, sir.
Yes, sir.
Ready, ready.
Okay, so just very thankful. I'm very thankful. अब क्या कर? What you do? Simply for it is only 5 minute practical. आपको क्या करना है? Sit comfortably in the where you are sitting, and feel your feet on the ground. कुछ नहीं. You don't have to do any meditation. Just feel your feet on the ground. Okay, and for some time have the sense of settlement. No need to take deep breathing. No anything, nothing. Okay, and now take 1 minute for settle and feel your feet on the ground. And your eyes are gently closed. And feel your internal state at the moment, because your hypothalamus is scanning your internal state. And you will surprise, in some areas of body you are good and you are not good. Just acknowledge that. You'll be surprised your breathing is also irregular. Just acknowledge. No need to react anything. Now put your two palms on the eyes just like this. You can look at me. Simply look at this, and this thumbs gently massage it. कुछ नहीं करने का, सिर्फ be with yourself for some time. And see how your eyes look when you are closed. If there are multiple lights, then your mind is unsettled. Notice the darkness which comes automatically. हमको कुछ नहीं करना है, just be with yourself and see what is happening at your foot. No chappal, sir, just direct contact with the ground. Up now what you do? You put one hand on the back of it and one hand on front of it. एक हाथ सर के पीछे, एक हाथ सर के सामने. And see what is, how your body is getting difference experientially. अब क्या करना है? Gently put your hand from the forehead to the top. प्रेमाने डोक्यावर नाच फिरवा. Do it practically, huh? And feel the touch of your hand. And see how your internal environment is changing. करके देखो. No pranayam, no meditation, nothing. Just simply be with you and see what is happening at your feet. पैरों के तल को क्या हो रहा है अनुभव करो. Simply you are making the gentle movement. आराम से. अभी दोनों हाथ साइड को लो, just like this, and simple tap करो as if you are tapping very gently. जसे की लहान बाळाला आपण थोपटतो. You are tapping a small child. I see the minute change which is happening in your body. Few moments before, the energy which was in the upper body is descending slowly down. अब gently हमारे चेहरे से हाथ घुमाओ. Very slowly. See the power of self-touch. ये मानो हमारे मदर का टच है. You can feel it. No hurry. But देखो, your body is transforming minute to minute. You were different before and now you are different. अब क्या करना है? Put your hand to earlobes. Earlobes को थोड़ा सा मसाज करो. Feel your lobes and gently massage and see what is happening. I got eructation. Eructation is the way body discharge that stuck up energy inside. You can feel the sweating at your feet also. Sweating is also a way body discharge all the stuck up energy inside. Feel it. Gently massage your pinna. अब क्या करना है? Put your hand on the throat and gently massage the throat. आराम से. See what is happening. You will feel a sense of release happening from your body. Sweating might be happening. The energy which was in up now getting down. और breathing हल्का हुआ है. देखो, it is happening automatically. You are not doing a single pranayam. You are not doing even any meditation. Now क्या करो? दोनों खंदे पे हाथ रखो and just simply press it. आराम से करो. Very gently. See how it feels. अब आर्म्स को देखो, 4 उंगलियां सामने, अंगूठा पीछे, and just give simple hug, self hug and massage. Or see how your breathing is getting restored. It is happening itself. आराम से हो रहा है. थोड़ा हाथ को gentle shoulder to elbow massage दे दो. And this is happening why? Because your vagus nerve is getting activated now. You can feel that sense of relief. You are bringing yourself from dysregulation to regulation. Can you feel that? A sense of sweating, sense of lightness in the body. This is a felt sense. Now put one hand on the chest And second, support with second hand. You are holding both hands on the heart. आराम से रखो. Feel how it makes a difference. अब एक हाथ छाती पे, एक हाथ पेट पे रखो. One hand on the chest. And gently feel your breathing happening by itself. दोनों हाथ अपने थाइस पे रखो and touch one finger, index finger with the thumb, and feel it yourself. And see, maintain a beautiful smile on the face. और थोड़ा सा दोनों हाथ अभी लेके शेक करो, जस्ट शेक एंड से just feel it and see what is happening inside. थोड़ा देखो क्या हुआ. You were different when you were sitting before, and now you are different. You are. Anybody can share. This is a very simple phenomena to bringing dysregulation to regulation. Your hypothalamus understand it's a very 5-minute process. You can do anytime you want. Come on, you are sharing.
Thank you, sir.
Have you experienced this change?
Yeah,
This is a very
thank you.
classical
It
ventral vagal
reduces
activation.
our heart rate. Yeah.
The classical ventral vagal activation, beautiful exercise, only 5 minutes, which should be taught before any of the training, any of the class. Our hypothalamus understand only dysregulation and regulation, safety and unsafe, safe and danger. यही तो स्ट्रेस मैनेजमेंट है.
Thank you, sir. Thank you.
अलग कुछ भी नहीं है.
Yes.
Have you enjoyed?
Yes, sir. Definitely.
Thank you so much, sir.
Thank you.
For
Third
this,
activity now. Yes.
after this self-regulation and mental health awareness, we will move towards our self-defense activity. So, over to you, Bharat sir.
Yeah, can you?
Yeah, please share your screen, Dr. Bharat Rama sir. They are going to show us a one move at a time, every time.
Can you see?
Yes.
We can see. We
Yes,
can.
sir. Yes.
Okay.
Yeah. Just
Can you hear,
increase the volume of your voice.
Yes. Can you hear us clearly?
Little more, little better.
Or? Yeah,
You
can
are
you hear
audible.
now?
Yes.
Yes, perfect now.
Perfect. Okay, we'll start. Good evening to all of you, madam. Now we have here Mr. Bharat, Sensei Bharat. I don't know, can you see you here? Yeah. Here. Sensei Bharat here. And you know, your buddy, Colonel Pradeep Reddy sir. And I am Professor Bhaktiar Chaudhary, sports medicine consultant. And we are all the team. We do all these activities. Now let us go. Let me end the presentation.
We could see your presentation, sir.
We could see? Okay.
Yes. Yes.
We are not able to see, just a minute.
Yeah. Just start sharing the slides, means moving the slide. Try to move it.
Yes. We are not able to see. One second, madam.
Okay.
Share. Can you see now?
Yes, we can see and we can hear. You can start, sir.
Yeah. No, we are not able to see that. Sorry. Huh?
Presentations.
This? No, Kadu. Oh, yeah. There is a thing.
Sir, are you not able to move the slides?
Now, yeah. No, we are not able to. Share only. 1 second, I'll share again.
Yeah.
We are not able to see the slide, that's why. Okay, done. Oh, sorry. 1 minute. 1 minute. ఎక్కడుంది లేదు స్టాప్ షేర్ చేయాలి ఒక్క నిమిషం రాంగ్ వచ్చింది మనకు లేదు 1 minute. Just 1 minute. అది కాదు మనం షేర్ చేయాల్సింది
Just give us 2 minutes.
1 minute, 1 minute, madam. Because a video, no?
PowerPoint
Okay, Yeah. Yes, done. Okay, madam. Yes. Yeah, good evening to all of you. This is the future of our country. You can see here, almost 700 young girls were recruited into Kerala Police. This was our one-day program for them. And these are the future of our country, sisters, mothers, leaders, pilots. And India had a great culture of keeping a lot of great women entrepreneurs, and all the mythology, history of India, starting from Bharat Mata to young girl of today, we have given a lot of importance and respect, but situation is slowly changing. Now, if you see carefully, there are a lot of women who have done wonders. All the faces are very known to us, yet we come across lots of assaults on women, rapes, murders, and media is full of these. Now, if you go carefully, is India safe for girls? When I went abroad for a couple of conferences, some of them asked, is India safe for women? Can we visit? I felt very ashamed. Truly, every couple of minutes, somebody is being assaulted, raped, murdered. I don't want to see the statistics because they are so pathetic. However, there is some movement is taking place now. And it is a need of the hour to understand. We raise our slogan, we raise our voice, we train our young ladies, young girls and women, especially the adolescents. Time has come to raise a situation. Now, if you see carefully, there are a lot of sects of people who are talking about women and their self-defense. But this is not just a normal behavior. It's a psychosocial behavior. Just now we heard wonderful presentation, the doctor predecessor who talked about stress management, mental well-being also spoken about. But there is something wrong in our society. These are the males, chauvinistic, misbehaving, immature, not well-trained. These are the people who commit crimes. And many of the examples who studied by sociologists, they found there are problems in bringing up these males. They do not know how to respect women. They do not know how to look after their colleagues. And these are the people who create crime. And the whole society, country is blamed for it. So there are problems in bringing up, and our social structure yet to mature so that these boys don't make these things. Family culture is important. A lot of these boys who committed crimes, they are from broken families because the boy has no association with the mother and other girls. And co-education is a very important intervention in our educational system, where at least boys, girls from younger age study together. They live like they develop an association of a brotherhood, sisterhood. So these are the things which are important. Now, what happened to our education? All boys' schools separate, India, Pakistan separated. And when they come face to face, especially in adolescent period, one side the hormones are making havoc, other side is the media exposure, giving an opportunity to try all those. So remember, education system itself need revamping. Lack of female siblings also found to be one of the reasons why these boys behave wrongly. Male hormones, of course, we are all doctors, we are aware of them. So order of the day is our girls need to have a proper self-defense program. Every girl must defend herself, escape herself, and complain about it, and raise the voice, and train down the echelon. Everybody should be trained in this art, which is freely available in our India. Now you see, these are some of the, a small young girl can easily destabilize a strong person like me in a demo. If training is given, especially hands-on training with good education, with 1 day workshops, 2 days workshops, not like this 10 minutes program, of course, it's only an eye-opener, girls can develop reasonable skills to defend themselves and escape. Now, there are a lot of things we need to talk about it. We have lots of techniques available today in the form of animations, videos. If you look at Reels alone, more than there are 12,000 videos available on self-defense. And there are many YouTube long videos on different levels of self-defense. But we need to understand these diagrams are not going to give you the will to fight. These diagrams are not going to really help you. It is only to improve awareness that girl can protect herself. Now, slowly we look at into, if you understand the amount of assault and problems exposed to women all over the world, it's not only in India. First, we lack awareness. Girls don't know when things can happen, what can happen, and their posture itself gives a welcome. If she is very feared, depressed, that gives more confidence to assailant. Eye contact itself is very important to understand. Raising a voice, escaping from the area. Apart from these, there are situations which can be very, very serious. A girl falls on the ground, very difficult to escape. So these are termed as ground defenses, bridging, shrimping. So various, in fact, you need to, I saw one slide talking about somatism. A somatic awareness is very important for a girl to use her musculoskeletal system so that she can guard herself in a very pathetic situation. Human beings have a lot of joints which can be locked easily, which can be broken, which can be injured. And there are a lot of points in our body where neurovascular bundles, neuromuscular bundles are in access to us. For example, temple, collarbone, neck. And we can have small weapons handy, pens and pins. There are a lot of shows people have shown, but we need to have a guts to use them. So we'll go into a little more detail. Now, this is a strategy actually. What is the escape strategy for a young adolescent girl from an assailant? First, they must remember men are more stronger because androgens, testosterone like hormones increase men muscular power. Their musculoskeletal system is stronger. Their bones are heavier than women. Their cardiac output, stroke volume, everything is, women are equal to men in many jobs, but not physically, anatomically. So one must think that man who is going to attack a woman is more stronger than her. So that should make the girl more attentive, more focused. So that's why the training is required. Body language and behavior of a man, very easily understood, especially people from their own families, chacha, mama, bhatija, they keep meeting these young girls in their parties, functions. So they keep an eye on them. So girls need to be taught by their parents and the teachers how to understand the body language of a negative person. And today, women are more independent, girls are more independent. That's very, very good. But that doesn't give you warrant to walk around in 2 o'clock in a lonely road, because you're increasing risk. The risk behavior attracts a lot of problems. And most of the cases, what I've done, you just study, all of them had a high risk behavior. Example, a girl is getting more drinks in a pub. She's at risk to be carried away after the time, because intoxication leaves her with no sense of escape. So, of course, these are not new things, but still avoiding risk is a important thing. We also talk about, in case an assault has happened, how to go about it, where to go, whom to report. Anyway, it's not the purview of our lecture today because we have very limited time. Now we go ahead with our situation. Yes. Now you're all medical professional, and that too, our lectures are focused to provide education to frontline workers like nursing force, ayas, doctors, house surgeons, women on night duties. Everybody have little bit of anatomical knowledge. Men or women, all of them have some vital points which are very weak. We have joints. They are in some places very weak. There are also strong joints like hip and knee. And everybody has fingers and toes which can be easily broken. And the pain from a toe or a broken finger is excruciating, and assailant can escape. You must revise your anatomy, temples and ears, eyes, bridge of the nose, and of course, Adam apple, the thyroid cartilage, and close to is your deeper is carotid arteries, and more laterally you have jugular veins, and of course, cervical spine is not as strong as lumbosacral or thoracic spine. So head itself is a weaker area. A girl, if focuses on his head and other surrounding areas, escape is very easy. Solar plexus is commonly described, but most of the men have very stronger solar plexus. So don't try to hit on a solar plexus, girl cannot escape. Yes, axilla has a lot of brachial plexus and other neurovascular bundles, and ribs and underneath liver, a very important vital area. And closer, we all done anatomy dissection, exposure of kidney just in the loin region. These are the most weaker areas. We are not going to groin and other areas. So today we are focusing our lecture, our presentation, short presentation, on one side of the body, because it is out of purview to teach all the techniques in this session. So today we focus on lateral line of the body, away from the line of assault. So how to escape by hitting on the temple, how to escape by hitting on the ear, how to escape by hitting on the other areas of the face. The first technique is, just hold here. You see, a most common technique of a person to go into defensive pose to safeguard your head. Now I'll show you once again. See, this is very natural. You don't need a training to escape from this. But the boy like this, strong man who is hitting on your head, can cause quite a bit of injury. And if you can save this, at least first primary assault is saved. Now we're going to show you a little more techniques. They have been, you can see on the left-hand side is the Sensei Bharat, very senior trainer. Other side Ramakrishna is also a very good. You can see how you can escape from your bent elbow position, and it gives you vacancy to push him. See, he doesn't expect that you're going to push him. He's only expect for you to save your head. So remember, pushing away the person is one of the easiest strategies. Suppose that fellow falls down, the girl can run away. Now, similar situation where you guard yourself and his face, vital point is open. So you first foremost punch a free hand movement onto the temple. You all know the temple is the weakest part of the skull. Underneath, the tremendous blood vessels are there. Person may have an injury here and he may fall down after later some time. Now you see again display with the other side. Blocking is easy. Just bend your elbows and slowly go onto the neck this time. Just see neck. So neck has got a lot of structures. Another direction. You see, neck is a very beautiful area. You just open your arm, that's all. It lands exactly on the neck. You can injure a jugular vein and carotid arteries underneath. This can be a real serious. If the girl is very strong, it can be a fatal also to person. But doesn't mind. We can bring you back bail, even if you kill a person, but saving yourself is very, very important because assailants' intentions are not very good. And you can see there is a ear, and with an open palm, if you hit on the ear, the air pressure can straight away break, bombard your eardrum, and it can be a very, very serious injury. And the sound echoing in the ear can make the person absolutely unstable. So this is what is the slap technique. The common assault is a slap on the head. Now you can see another application is hitting your fist into the axilla. Now I don't know how many of you remember still anatomy of the axilla. This is lot of brachial plexus nerves, brachial artery, all the branches of the brachial artery and nerve. Everything is in the axilla. You don't need to punch, you just push. Now once you hit the, now you can see again another technique. Axilla, I want to show you any small girl also. Poke her. 1 minute. Poke her. Yes. You can see this strong boy, he just almost lifted his body because to protect from pain. And in axilla, there's a lot of space where you can punch your hand very easily. Fingers can show. You can put your pencil, your pen. So axilla is a very important vital point to escape from a huge bodied, even a trained person also you can escape.
Yeah. Sir,
Then you have a,
hurry up. Sir,
yes,
sorry
yes,
to
madam.
disturb
Yes,
you.
madam.
Please
We'll
hurry
finish
up.
it off. Yes.
Yeah, it's already.
Now you have a,
yeah.
another thing is a rib. Rib has got a lot of painful situation, and underneath the rib, you have a liver. So one punch, free hand punch can cause a lot of pain to the assailant. And you have a next technique. Just see this. We're almost done. Yes. You can see here how this man is whole block and hit on the liver first and then onto the kidney area, the loin of the back. This has no big muscle and no hanging ribs. And the last technique is the girl who is sitting and doing some work. Assailant can come from behind and grab. The first thing you have to do is clench your head because chin has a very good power, and our trapezius and sternocleidomastoids and masseter, all these muscles can give you a lot of strength to clench your chin, and you can hold your chin tight. And now you see the next movement. Now, with the left hand, you hold his wrist very carefully, tightly. Even a young girl can perform this technique. And with the right hand, hold your elbow, and also near the ulnar, now you can pinch with your finger. That is not clearly seen here. Now you can push like this, and the person is in your control. With your left hand, you can even hold this person's finger. He is totally under your control. And even a big bodybuilder cannot harm a young girl. And this is what is the technique from a sitting position. Yes. So I know this is very, very little time to explain all this.
Yeah,
however, understanding the situation in society, mental preparation, willingness to escape and attack. So we need to really hands-on training for young girls and all the women, especially adolescent girls, are the highest risk group in our society.
Yeah.
Thank you very much.
Thank you.
It was a
Thank
nice
you, sir.
presentation by all of you.
Thank you. Thank you,
Good
sir.
night.
Over to Swati.
Yes.
Thank you so much for the fantastic presentation. Now I will request Dr. Geeta Patil madam to sum up today's lectures and today's presentation. Dr. Geeta Patil madam.
Yes, Dr. Swati, I think I should congratulate Dr. Sneha. She explained that menstruation is a natural process and we have to understand, and open conversation is very essential. It removes the taboo and stigma. And she explained the menstruation in a very physiology of the menstruation, HPO axis, and how the serotonin and dopamine, they are responsible for the mood disorder. Like estrogen is definitely a better thing, and progesterone also has got its allopregnanolol or something, but imbalance causes a problem. So, and very important thing, she highlighted the junk food, which is a very pet topic of us, that it affects the menstrual cycle, mood disorders. And yoga and exercise, walking, reducing the cramps, and then taking calcium, magnesium, B6, omega 3 was really good. And menstrual health is a window to the woman's health. I like that terminology. And emotional balance is very important. Regular tracking the parameters of the menstrual health may give us a clue about the systemic diseases also, like a hypothyroidism, anemia, anatomic defects, and so many things are there. And now the new terminology, all of us we know, is a polyendocrine metabolic ovarian syndrome. If Dr. Sneha is there, I would like to tell her the patient first come to us and we misdiagnose or maybe overdiagnose and label them as a PMOS, which affects their mental health. So we have to be very careful about what are the criterias for that. And this PMS is misdiagnosed, that is a true. And premenstrual dysphoric disorder, we don't see that much. PMS we see, but I personally have not seen that much disorder, because it is definitely associated with some other comorbid conditions, which I think she did not mention. Because PMS, any mental health problem, always it is associated with the comorbid condition. She explained all the things so well. And the menstrual and mental health go hand in hand. It's a good terminology. And menstrual literacy, we say digital literacy, this literacy, menstrual literacy, we should go on talking about that. But what I felt, for the pediatrician's sake, we should make a early adolescent. There is a problem of menarche, because there may be irregular menstrual cycle, and there is a little concern, fear, embarrassment. And nowadays we are seeing a premature thalarchy and menarche, and it is increasing. Emotional liability is there. It requires a little reassurance, family support, and correct information, what she mentioned. In the mid-adolescent, the cycles become regular, or maybe whatever the pathology is manifested, dysmenorrhea, heavy menstrual bleeding. And then she rightly has highlighted the school attendance gets affected. Some of them exaggerate their symptoms, which is very important for us, that menstrual reason to cause school absence is very important. Anemia is very common if there is any problem, nutritional deficiency. And during this phase, sometimes there is a body image concern is there. Then psychosocial stressors are there. By the late adolescent, they settle down with certain things. And whatever the pathology is there, here we require really help of a gynecologist, because sometimes endometriosis, PMOS, all these things are there. So we have to promote the menstrual self-care, very important. Reproductive health or menstrual literacy. By the time many conditions are very well recognized, like a depression, anxiety, self-harm, severe mood symptoms, premenstrual dysphoric disorder requires really a knack to understand, because many times we may miss it or overdiagnose it. And sir, Ratnaparki sir, I think I felt relaxed. Whatever you taught in the stress management. And menstruation is a jewel of woman's life and right of woman is a good terminology, sir. But I can say women are from Venus and men from Mars. So there are differences are there. I don't agree with certain things that men are little more stronger than females. I think that depends on our mindset also, sir. The team who has shown the self-defense. And Sanjay Ratnaparki said that hyper-arousal state, hypothalamic attitude, all these things I think we all have to remember. And pediatricians, why? Many of us are stressed. So stress management and you are that technique. I do regular yoga. But this is a really a simple thing I can sit in my consultation room and do for some time. And no breathing exercises, no pranayam, no movement. So we are very happy for that. So thank you very much. And the team who presented with the self-defense is required and it has to be taken on the bigger platform also, and it is a necessity. We know that when we were doing a post graduation medical college hospital, we used to run through those dark passages, nobody to escort us. But if these things are known to us, we will be confident, we can go travel, but we will not take undue risk. As he told that going to pubs or these things definitely has to be avoided. Where there is a risk to be avoided, we should not overestimate ourselves. So thank you very much, Chitra. And this is a really a mental health and menstrual health goes hand in hand. We understood and we know many problems, but how to put together was not known to us. Now we will understand everything. So thank you very much. I think it is little delayed. I think many people would have left. I think Dr. Sushma Desai is not there, I think.
Yeah. Over to Swati.
Yeah. Thank you so much, ma'am, for summarizing all from the lectures today. And now I will request Dr. Vaishali Shetty, madam, to propose the vote of thanks. And I
Yeah.
think,
Yeah.
and
I'm
ma'am
there.
will,
I'm there.
yeah, and
Yeah.
ma'am will tell us about the next webinar also going to tell.
Definitely. Yes. So it's too late now, but I would like to sum up. Dr. Geeta Patil has already summed up all those things. So many thanks to her. Thank you, Dr. Ratnaparki, Dr. Sanjay Joshi, Dr. Sneha Bhuyar, madam, for these excellent talks. Menstrual talk is little bit a day-to-day problem, but it's discussed very less and very not so commonly. So thank you, madam, for focusing on such a common subject, but discussed very rarely. Thank you, Dr. Ratnaparki, for this dysregulation to regulation also. And thank you, team self-defense, for guiding us throughout this. We will be having the next webinar, the self-defense mechanisms in next webinar also. And I'm very much thankful to Swati for moderating all this session very nicely. Swati, you did it very nicely. And I'm really proud of you that someone like you are budding who is coming here and presenting in such a good manner. So thank you all of you, those who are present. We had participants of 29, so that was a record, and that's a nice one. Next webinar will be by Dr. Vaijayanti from Sangli. Vaijayanti is there? Yeah, so she will be focusing on nutrition, and I'm happy to share that we will be having webinar on every fourth week of every month, maybe Tuesday or Wednesday, depends on the availability. So you be all of you be with us. Thank you, Chitra madam. Thank you everyone for this, and it's a good night to all of you. Thank you so much. Bye bye.
Good night. Good night, madam. Thank you. Good night. Thank you. Good night.
Good night. Good night.
Swati, you can end the meeting now. Thank you very much. Yeah. Yeah. Yeah, you can, if you are host, please end the meeting. Yeah.